I'd like to welcome Dr. Andrea Obi, who's an associate professor at University of Michigan. She's also one of the leading researchers in vascular surgery and medicine, and really had a very productive lab for decades. She's really one of the rising stars, if not already a star, quite frankly. When we are interested in looking at vascular research, we turn to her lab and really focus our questions. She's really had some remarkable successes in research grants, talks worldwide, and very well known. Today, we're going to be talking about a little bit about being a female in vascular surgery and medicine. And can you tell us a little bit about your experience in terms of work-life balance?
Oh, yeah, absolutely. Well, first of all, thank you for having me on this podcast. I was absolutely honored to be invited to be here today. And, if you'd asked me 20 years ago if I would be where I am today, I don't think I could have imagined this life. And I think that's very true for a lot of young women who are entering medicine now. Um, I don't know a lot of other, vascular surgeons or folks that live a similar life to mine that are married and have four kids and have a lab and a very busy practice. So it's sort of a unique position to be in. And I think I've learned a lot along the way about what to expect and sort of, in some ways, how to handle disappointment or not even achieving what you think you should achieve, which um, is something that's hard to do coming from, as we all are in medicine, high achievers. Um, so I can talk, if you like, a little bit um, about sort of expectations and managing those throughout your medical career. I think one thing that's very true for women that are in my career phase, which is sort of the early to mid-career, is that we are sort of the product of what I like to call like second wave feminism, meaning that, there was first equal right to vote, and then my parents' generation, which saw women, are able to have bank accounts, like to hold a checking account. And then all of a sudden, all this opportunity was open to my generation, which is like sort of the late Gen X and early millennials, to a bunch of opportunities that our mothers didn't have. And sort of with that opportunity came a lot of expectation. And I think when I went into medicine, what I expected was the sense that it was not going to be easy, but it was going to be the same for me as it was for my male colleagues. And in fact, when I graduated from medical school in 2008, it was the first class that we had in my medical school where there's an equal number of women and men. It's a straight 50-50 split. And that too, we sort of all greeted that with a lot of optimism. But one thing that's true is as you move through your medical career, it's certainly not the same being a woman in surgery as it is being a man. It's a lot different experience. There's a lot of sort of unspoken norms around behavior, microaggressions, that sort of thing. But then also what happens is as you get through this grind of being a surgery resident and checking the boxes and achieving the next thing, then you really, at some point, you enter real life. You're done with training and you look around and maybe it isn't all that you wanted, right? And so it's very hard, right? You graduate and it's very hard being an early attending. It's hard taking care of your family and and it's hard achieving what you need to achieve both in the OR and if you're an academic, sort of what you need to do there. And I will say, I have a colleague here whose name is Meredith Barrett. She's a transplant surgeon, and she's a few years younger than me in training. And she gave this great grand rounds when she graduated. And the title of this grand rounds was It's Okay to Not Be Okay. And I thought that was a very profound way to think about this. So you're in your career, you've done all the things, and maybe you're still not meeting your own expectations or you think it's your fault. And if you actually go back and look at data surrounding women in professional careers, there's a very interesting study that came out in 2017, and they longitudinally followed men and women in professional careers. And what they did is they looked at the psychologic impact of having a young family on people's careers. And what they found is that if, regardless of whether you're a man or a woman, having a professional career in general tends to be very mentally and psychologically rewarding, except for when you have small children. When you have small children, having both small children and a career is very detrimental to women. It's very, very stressful, and it's not a good experience. Now, when you look at men, it doesn't affect them. Not to say it doesn't affect everyone, but men have a very different experience of having a professional career and having a small family and having small children at home. So, looking at that sort of information sort of gives a little perspective, right? So it's okay to have a young family and challenging career and not feel like you're meeting all of those benchmarks. That was something that really took me a long time to realize, to come to terms with. I can't make every meeting. I can't do all the things in professional societies after hours that I might find interesting for my professional career. And sometimes you sacrifice, one thing with your children, missing a game for whatever you have to do for a patient. And that's sort of how life has to be at some point. And so that's a little bit of a hard realization to have, but also a very good realization when you think about professional and family success. You can be good in all your roles, but not at the same time. And I think that's something that took me many years to learn.
Well, quite frankly, you've done an exceptional job of juggling all of that. I want to talk a little bit about expectations for women in medicine and surgery. I've always told my wife, who's in family practice, that women actually, I think the bar is set higher for women um, to um, to have success in their professional life. And I actually think to succeed, you actually have to perform 30 to 50% better than their male colleagues, be it in residency, internship, or even as an attending. I feel that a lot of women are under the microscope much more so than their male colleagues. Um, how do you deal with that? How do you deal with some of the inequities? And I mean equities, and I don't mean just pay. I don't mean just um,
Sure. Yeah, the
it's everything.
behavioral norms. Yeah. I think, with behavioral norms and microaggressions and maybe getting passed over based off of some of these perceptions of women in surgery, there's a few things that really help. And a lot of them are outside of what you can accomplish yourself. So I think, for instance, as a woman in surgery, I always feel like you sort of have to behave in a certain way and always be a little bit on guard, right? You have to be very prompt, leave no room for sort of critique of the way that you act, be extra professional. But I think as more and more women enter higher roles, and it becomes more normal for women to have these leadership roles or to be attending surgeons or to be researchers, um, some of that perception goes away because at some point it's just normal. You don't have this imbalance where people are saying, "Oh, should you really be here? Should you really be at this table? You don't look like everyone else at this table." So one thing is, as more women infiltrate, I think the situation gets better for everyone. But also something that's tremendously helped me in my career is having both mentorship and sponsorship. So someone to go to ask questions, how do I act or how do I behave or how do I get, I see myself here and I want to get there. What steps do I have to take? So someone who can give you real concrete steps is a good example of a mentor. And good mentors are everywhere. Actually, my two very best mentors and sponsors are men. I didn't, there was, when I started my residency, there was not a woman who was a vascular surgeon at the University of Michigan that there was no one in that role. So my mentors and sponsors were Tom Wakefield and Peter Henke, and Tom Wakefield really took a huge role in being my sponsor. And when I said I was interested in what his lab did and taking me under his wing and mentoring me there, but more importantly, taking me out into the community and into some of these national meetings and introducing me and say this is someone who I think is really great. This is the next generation, and inviting me to sit at the table, maybe sometimes where I didn't even belong yet, to sort of promote me and get me into some of those areas where I would otherwise probably never have access to, or maybe never have, would have been very hard to earn on merit because sometimes you can't get places just by your own achievements. It involves knowing people. And so I think it's a little bit of a soft area, right? We're so used to like these hard, you just have to take this test or finish this assignment. But I really think that's a strong way of being from either gender to succeed in medicine or to find your way into a place that you want to go and don't know how to get there.
You mentioned the fact that years ago there were very few female mentors, but now there are more.
Right.
Not enough, but it is increasing. And I want to touch upon that role of a female mentor because that is expanding, and I think it's an important tool that can be used. Can you talk a little bit to that point also? Because you're also now a mentor for your multiple trainees over the years. Can you talk a little bit about being a mentor to other young, aspiring female surgeons or physicians?
Yeah, I think there's a little bit of good and a little bit of bad. I will say that sometimes when there is only one woman in a department, they get overrun with requests, right? Because everyone wants a mentor that looks like them, right? And it's really important to have someone who's a few steps ahead of you that you can use as a role model because it really helps envision for yourself being in that role and seeing what steps they took to achieve that. So, on one hand, something that I think is very true nationally is that women in male dominated fields tend to get overwhelmed with requests for mentorship. And that's a problem on the mentorship side of things. So, I want to reiterate that both men and women can be good mentors, but I really myself try not to turn down any requests for mentorship or at least, shadowing to see what the job is like. I will say one thing that I think has changed tremendously in my lifetime is, um, the this I spoke a little bit earlier about like this sense of optimism and hope and like feeling maybe a little bit of pressure from my parents' generation, right, where they created all of these opportunities for, for us to take advantage of that maybe they couldn't have in their lifetime. And I think the younger generation that comes to me looking for mentorship, um, I do have a sense that it is already feeling more equal to them, right? Like it's doesn't feel like such a big task or such a momentous amount of weight on their shoulders. And I find people coming to me for all sorts of different reasons. So for me, it was like I never saw, until we had Kathy Gallagher, who's one of my senior partners here. I never saw a woman vascular surgeon who was a really well-funded scientist. But now I have people coming to me not just because of the fact that I'm a woman surgeon. There's plenty of those around. They might come to me because they have some interest in the thrombus biology or in immunology or in some other area. And I think that's a very interesting shift that we're seeing. And it makes me very hopeful, for the next generation.
I actually agree with you. I'm actually very optimistic in this field because I think there's some really exciting changes that are taking place, not only here in the US, but internationally. So I think that we're heading in the right direction. I
Right.
do feel that women vascular surgeons and leaders really contribute significantly to our field and really do help push the ball forward.
Yeah, I absolutely totally agree. I think one thing that's happened too since the pandemic is with the rise of these webinars. I'm curious as to your opinion on this as well. But we've seen now, like some of our stuff that would be kept maybe more at the professional society level where you couldn't have access to this information or see a panel speak unless you drove or flew out to a meeting. Now, all of a sudden, this is accessible to many more people. It's accessible to trainees. And I think overall, at least in the professional societies that we're part of, or like, as our profession as a whole has been much better about representation on all levels, not just male, female, but getting young people who at the assistant professor level who are innovators, senior people who have been in the field a long time. So I think that was something actually that was good that came out of the pandemic is the rise of these webinars and really multifaceted panels that represent all of our different perspectives.
I could not agree more. I think these webinars, online platforms are here to stay in one form or another, but I do think they are changing. Um, Sometimes it's shorter webinars, shorter
Right.
podcasts, micro learning. It's changing. It's not the same webinars that we had 3 years ago. It's constantly evolving. The technology is going to change, and it does offer great opportunities for leveling the playing field.
Yeah, absolutely.
I want to thank you so much for talking a little bit about some of these issues. These are super important issues, as I said, not only in the US, but globally.
Oh, absolutely. And I'm really happy to be where I am right now, and I'm just so hopeful for the future. So thank you for having me.
Thank you.